Hello, welcome to another episode of Navigating Cancer. Again, I'm Joey Bennett, radiation oncologist at the Robert Boisneau Oncology Institute, and I'm joined by Wendy Hall, who is our licensed clinical social worker. How are you?
I'm very good. How are you today?
Doing very well today. I actually feel good. I'm not really tired, and bringing that up, we're going to talk about that today. One of the common things that we run into when you deal with treating cancer patients, whether it's from a surgical standpoint or radiation or chemotherapy, is fatigue. And it is a very common symptom. It's something that everyone seems to experience to varying degrees, and so we want to cover that today so that we can get into some of the details about why it might occur and ways that you can deal with it. And part of it is physical activity, but other ways that we'll discuss later on are some coping issues, sometimes letting go and letting others do some things.
It's an emotional fatigue also.
I mean, it's emotional and physical, exactly. So as we talk about cancer fatigue, we're going to cover the fatigue. We're also going to cover some options that are related to treating it as we go along in today's program. First of all, what is fatigue? And fatigue is different for every single person, but the basic definition is when a person has less energy to do the things that he or she normally does or wants to do on a regular basis. And we all have our normal routines of what we do on a daily basis. And if all of a sudden we get to a point to where we just don't have the energy and don't want to do those, it really starts to affect our quality of life and also our quality of our family's lives. And so we want to try to make sure that we understand what it is and what we can do about it. It is by and far the most common side effect of cancer treatment, no matter what type of treatment you're undergoing. And it is not always relieved by rest. It's not one of these things that you can just tell someone, let's go take a nap and get a little bit more rest there. That just does not always take care of it. And it can last for months. You and I see this very frequently. It can last for months and months beyond completing treatment because your body is still working really hard and it's trying to recover from the therapy. And then there's the psychological aspects of it that affect a person's emotions. It affects a person's mood. And one of the biggest things I hear from people is that they just have a lot of trouble concentrating.
Right.
With it. And I think a lot of that deals with the psychological and emotional stress that goes along with it.
Right. And I think that sometimes people don't expect, when they're done with their treatments, they think they're just, they're well and they're ready to go again, and they're a little shocked and put down by the fatigue.
And I think it's one of the things that we try to drive home is, don't be discouraged if the fatigue doesn't go away right away, because the more you do, the better you're going to be, and eventually the fatigue will improve on you. Fatigue can have a lot of different causes. It can be from the cancer treatment itself, again, recovering from surgery and anesthesia, recovering from radiation, chemotherapy. It can be from a loss of appetite. If you're not taking in the calories that your body needs on a daily basis, that can make you very tired. Third thing is exercise. I mean, we all need to exercise somewhat. We've discussed on this program several times before the need for exercise, the need for maintaining a good weight. And too often I think people will come in, they'll start a cancer treatment, and they'll think they need to take it easy. And it's actually quite the opposite. You need to continue to try to do the things that you've always done, and maybe even push yourself a little bit more than you have in the past. And then finally, the cancer itself can make you very tired. Cancer is basically a foreign body. It's growing inside you. It is depriving you of calories and energy. So just the cancer itself can make people very tired. And so after we know what's going on and we understand this, I think it helps us deal with it psychologically very well, because you understand I'm tired, you understand I'm supposed to be tired, and you should not be feeling these feelings of resentment or feelings of guilt about the fact that I don't have the energy, I'm not out doing the things with my spouse and my family that I used to do. And I think that's a big area where Wendy comes in and is involved in the practice when we're sitting down with patients and we're sitting down with their families, talking about what their expectations are and helping the family cope with this. I mean, what are some of the things that you tell them to be ready for when they're patients?
Well, I just try to tell them to remember that they're healing, that this whole thing is a healing process. And if we had, a scratch on our arm or something, we would be healing from the inside out, and that's what we're doing. and just not to expect that we can just, you know, jump right back in. But I think it's a very good message, one of the points that you made earlier about keep some exercise in your routine. I think it's easy for people to think, well, I should conserve my energy because after all, I don't have any, right, and all of that. But I think people are much better off and feel better when they do keep some walking or whatever it is that they want to do.
Well, if you're accustomed to some sort of a daily routine of walking or working out at the gym or riding your bicycle and things of that nature, your body has become accustomed to that, and that exercise is part of what gives you your energy. It's what gives you your drive.
Your whole emotional well-being.
It makes you feel good both physically and mentally. And if all of a sudden you take that away, you're going to feel a little down. You're going to feel a little deprived of the things that you enjoy. I mean, it's hard to believe that some people do enjoy running. I always tell people, if you see me running, pick me up because someone's chasing me. But there are people who enjoy going out and running and walking and riding bicycles. And if all of a sudden that is taken away from them, and they're going through a cancer treatment and they're going through the psychological and mental aspects of dealing with this disease, it makes it very tough. So I tell all of my patients, please try to keep pushing yourself, to a reasonable extent. Don't overextend it, but the more you do, the better you're absolutely going to feel. Fatigue is extremely common, and on this slide you can see that it's probably something that we overlook very often, but 76% of patients who are undergoing therapy for cancer, whether it is surgery, radiation therapy, or chemotherapy, will complain of fatigue. And as we said earlier, it can sometimes be debilitating exhaustion, sometimes from anemia related to your chemotherapy, but it can take months to recover, because just because you came in and got your last dose of chemotherapy or you got your last dose of radiation treatments, your body is going to continue to heal up, as Wendy said, from the inside out for months and months. And occasionally, people will tell me that it sometimes takes up to a full year before they will feel like they are back to where they want to be. But the quicker they recover, the better they're going to feel. And a lot of times, the more they do and the more active they are and the more they push themselves, the better they're going to feel. So it's something that we absolutely probably overlook a little bit, but we understand how debilitating it can be. And part of this is the patients talking to us. Very often you'll have a patient, they're undergoing treatment, you ask them how they're doing, and they'll say, fine, just fine. I don't want to bother anybody with it.
They don't say that to me. They say, I am so tired. I am so fatigued.
But we want you to tell us if you're noticing that fatigue, because depending on what's causing the fatigue, there are things we can do. We know that it's often overlooked. We also know that we don't understand the full rationale of why it occurs, but we know that there are ways to go about treating it. And when we come back in the next segment, we're going to talk about some of the symptoms that you may experience with fatigue that you might think aren't related to fatigue.